Tonight in the pre-show, I want to talk to you about a Maine doctor who's done something revolutionary. What this Maine doctor has done is he's basically said that he is going to reject health insurance, all right, and get rid of the middleman, i.e. your Kaiser Permanente, your Blue Cross Blue Shield, your Aetna. He says if he gets rid of them, he can make his prices cheaper. And so on April 1st, he decided to stop collecting health insurance altogether. This is no joke, serious. And you ask yourself, well, how is it possible this doctor's making money? This is what he's doing. He's charging a straight up fee for service without the inflation. So for a basic brief visit to see the doctor, pay $50. You want a checkup? $150. Minor surgery, $200 to $250. He says that this decision will allow him to charge less, get rid of the middleman, make house calls because he doesn't have to spend so much time dealing with insurance and insurance companies, negotiate with patients that are having hardship, and, really work for the people of his town in Maine. His name is Dr. Michael Campe, by the way. And so what this sort of did for me when I heard his story, the reason why we're talking about his story today on the show, is because I think what he speaks to is the fact that if we could get the middleman out of our healthcare insurance, we can get the middleman out of our healthcare, we can solve our healthcare issues in this country. Now, the Affordable Care Act is a step in the right direction. What the Affordable Care Act says that everybody, no matter who you are, has the option to get healthcare. But the Affordable Care Act depends upon a private insurance system to make it work. And therein lies the problem. Because the private insurance system is the reason why our healthcare costs are so high as it is. Because these insurance companies, they inflate costs so they can make profit, right? And now doctors inflate costs so that they have the ability to make money off the insurance company. And there are other reasons why doctors inflate costs is because of the whole situations we have in our legal system about, malpractice insurance, etc., 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 etc. Now, if we have a single payer system, or a system in which the government pays for everybody to get health care, right, we can solve a lot of our problems. Because I think in a single payer system, you have a better argumentation for why we need to create tort reform, or we need to change how we do our malpractice laws in this country. Having a single payer system allows for everybody to get health care no matter what, and get rid of the middleman. If this doctor in Maine can do it without health insurance, this country can do it without health insurance. He's been able to decrease his prices by almost over 300% and still keep a roof over his head. This system works, America. And if you don't believe it works, look at all of our developed country friends and allies. Canada, the United Kingdom, France, Germany, all these places have universal health care. And even as much as we don't like Cuba, Cuba has one of the best healthcare systems in the world because they believe in this whole idea of a single payer healthcare model where they train individuals to be stewards of this country's health, and they reward them for being stewards of the country's health, but at the same time, every citizen has the right to see a doctor. You might not like Cuba's governmental structure, but you can't deny the fact that Cuba has a great healthcare system and some very healthy people. What I say all this to say is that the Affordable Care Act is a step in the right direction. The question is that what do we do now to make sure that we can improve upon the Affordable Care Act, upon the Affordable Care Act? While Republicans in Congress have voted 39 times, the number escapes me because it's so rather large, to repeal Obamacare to no avail, we really should be trying to come up with solutions to make the Affordable Care Act even better than it already is. America, we can do this, but it requires all of us demanding more from our elected officials, demanding more from our government, and more importantly, demanding more from ourselves and saying, don't we all deserve health care in this country? As one of the richest countries in the world, don't we all deserve a chance to go see a doctor without dealing with an HMO, without dealing with an explanation of benefits, without dealing with signing up for an exchange? It should be just a birthright to have health care, shouldn't it?